Well, hello there again. Happy Wednesday. We are here for our practice fuel. It's our weekly check-in. It's a 15-minute lesson to go over how we can help you to gain some insight in some of the systems in your practice. Today, we're talking about objections. So it's very common to have patients come in, think about treatment, try to understand, okay, what are we missing here? Well, we got to remember that it's not just a no, it's a not yet, right? Objections are not necessarily a rejection. It is something that maybe the patient needs to think about. How can we take whatever it is that the patient's main pain point is, and how do we turn that into a communication, a strategy? So when we hear a patient saying, not today, I've got to talk to my spouse, I don't want to schedule yet. How do we take those objections and turn them into opportunities? So that's what we're talking about today, is those objections in the office. And, a lot of times the barriers are fear, they are money, those financial barriers, and sometimes they might come across as financial barriers. However, it really is fear, and the patient's not necessarily letting us know that. So what I want to talk about today is how we can help to think about our mindset shift just a little bit differently. So as a patient's coming in, how do we make those connections so that when we are talking to the patient, they're valuing the treatment like we would value it? We all day long in the dental office, all we're doing is working with patients in their teeth and their oral health. And so we know with years of experience what those problems can turn into. So every once in a while the scare tactic will work with a patient, right? If we're making the talking to the patient about, oh yes, this broken tooth can turn into something more, which is true. However, the scare tactic is just, not what we want to use on every patient every time, right? It might work on those few. And it's something we're letting them know. We have integrity that it's here, but how we say things, our approach needs to be tailored for each individual patient. So what I love to call it intentional communication. So it's not necessarily scripts. It's taking a scenario. Let's say the barrier, the objection is finances. And how can we take that specific barrier and create an intentional communication that we automatically have a response? Because in the dental field, we know what patients are gonna, they're gonna say no to. Time, their schedule, finances, the desired outcome, what it's gonna feel like, the process. So if we already know what those objections are, let's proactively take those objections, and this is an activity you can do in a team meeting, and you say, okay, what's a common objection? And what is that barrier? And how can we communicate that in a style that the patient's gonna understand it? Because sometimes, as clinicians, we can talk over their head, we talk a little bit too much jargon, all those dental terms, number 3, MOD, and patient's like, what's that? It's okay, we'll translate after when we're done. But if we want to really look at how we communicate with the patients, let's take a step back. One thing that you can do is you can have somebody, and this takes a little bit of vulnerability, I'm not going to lie, but have someone have a checklist, and we have those available for you as well. We can send that to you. But it's someone watching your case presentation as you're doing it and giving feedback. So being open to that feedback, saying, okay, how did I approach this patient? Did I have eye contact with this patient? Did I show them the x-rays? Did I show them the intro photos? Did I do everything that I could have to potentially get that patient to schedule? And they still said no. So getting the feedback is a great way to understand, okay, what am I possibly missing? And then, or you could video and get some feedback back on that. You just have to make sure you're in a state that you can video. Or you can even role play at work with your team. So if we're taking a look at how we're presenting now, and then we're taking a look at the patient's objection, and then we're taking a look at how do we communicate that, really gives us insight as to how we can tailor it to the patient's needs. So again, getting back to the financial one, it's a big one. What are we offering for financing? Are we offering care credit, Sunbit, Cherry? Are we offering different avenues that the patient can say yes easier? Or do we already have a barrier because of the finances? So some of those easy third-party financing options are great. And then you leave it up to the patient. You let them know, this is what we have to offer. Would you like to try it? And they can say yes or no. But it takes out that little bit of barrier that it could potentially be finances. If it's scheduling, let's go ahead, get you scheduled. And if something comes up, go ahead and just give us 24 hours. It's fine, or 48 hours, or whatever your protocol is in advance, and we can always make a change to that appointment. We're going to reserve this time now. We're going to get you scheduled, and then we're going to go ahead and follow up with you. Same thing with those objections I was telling you about. We want to make sure that we eliminate as much as we can while the patient's in the chair. So one thing I like to do is have the doctor have an agreement. So once you've gone through the case presentation, you've identified what the issue is, you've discussed it, you educated the patient, and you've given your advisement on what the next steps are, really solidifying that technique of how we hand that off to the front office and how we connect to the patient on helping them understand what we would recommend as the expert, right? It's still the patient's final decision, but if you were my mom, if you were my dad, if you were my sibling, this is what I would want for you in your dental care, in your mouth. So really connecting with the patient in that way to help them to see, like, this is not just someone who walks through the door. I'm treating you like my dental family. So this was what I would want for myself as well, and then help them to make the decision. So Mrs. Jones, I've gone through a few options with you, and are you in agreement that we need to do a crown on the upper right area, and that's the best treatment option for you after everything I've discussed? So when you ask for an agreement with the patient, it really does help that case acceptance, because then what? You can hear their response. If they say, oh no, I don't, then you can say, okay, tell me more. What about this treatment presentation? What about that don't you understand? How can I help you understand? So then you have those clarifying questions. And if they do say, yes, that sounds great, yes, let's go ahead, then you hand off to the dental assistant or whoever, the hygienist, whoever's there, and say, okay, I'd like to get you back in the next 2 weeks. Now that's assuming you have time in your schedule in the next couple weeks. So then we're giving them a solid timeline of a guideline of a timeline. So then we can say, okay, let's get you back in the next couple weeks. Really get this taken care of. Because, motivation lasts, 7 days or so? How many times you got a gym membership and, that first week in January is awesome. And then after that, it's like, not so much. Well, as soon as they leave, unless they have a toothache, right? Toothache, we get 100% case acceptance every time. You get them out of pain. Sometimes they come back, sometimes they don't. And that's a whole nother episode, another practice field we'll work on. So today, what did we learn? We learned that intentional communication, getting those responses done in advance, will help you to be aligned with your team. It'll help to tailor your conversation, have it feel conversational to the patient, and helping them to understand that we understand, time is important, that finances are important. We learned that having financial options for the patient will help more yeses. That'll help overcome barriers. If they say, okay, finances are an issue, well, what's our solution to that? Here's some solutions for that. We also learned that asking for an agreement is really effective in getting clarifying questions from the patient. So we don't know if they leave there and they don't tell us. We haven't really identified what they don't understand. So those are a few things I want you to, trust your team, trust yourself, and get those feedbacks. Take that, get a little bit vulnerable, and say, okay, can someone watch that? And we'd be happy to come in and do that for you as well. You want a third-party person, someone unbiased coming in, going through that? We'd be happy to do that. It really does make a difference. So some of I also, outside of dentistry, I also do fitness classes. I've been teaching fitness classes since I was 19, even longer than dental. So teach kickboxing and like a weights class, bodyworks and abs. And so when I got certified, I had to take videos of myself teaching and watch myself back. And it was horrifying. I was like, what am I doing? And then I was doing some speaking and getting videos and watching myself on leadership training and all of that. And so it really does make a difference when you can look back and learn from how you interact with patients and get that firsthand knowledge. So my challenge to you is to get a little vulnerable, let someone come in, give you some feedback, and try those tips. Next week, come back next Wednesday, every Wednesday at noon Arizona time, because that's where I am here in Arizona. Come and join us. Get those tips and tricks. Leave a comment. Watch this later. Take notes. Let us know how we can help you. And let us know, once you've got it in practice, how did it work for you? So anyway, we are back on next week. Come back. We'll see you then. All right. Have a great day, Facebook land. Bye-bye.